Okay, good afternoon. For everybody who is joining us, I'm just going to wait, maybe 30 seconds or, about a minute or so to make sure that everybody who wants to join is able to join. So if everybody will just sit tight for just a minute and then we will get started. Okay, I'm going to go ahead and get started. I think we have the majority of folks who RSVP'd have joined us now, so we'll go ahead and get started here. For everybody who's joining us, welcome. Thank you very much for joining us this afternoon. So we have gathered a panel of experts from Penn State Children's Hospital who can talk with you this afternoon about COVID-19 and pediatric care. We will, to start, I will introduce all of our experts here and give them an opportunity to make a few comments. And then after that, I will open it to questions from you guys. So if anybody who has a question, please use the chat function or the Q&A function and put your question in there, and I will moderate here for our experts. Feel free to put a question in the chat anytime, that we're talking and getting started here. Anything that you think of, go ahead. But after we all make a couple comments, I will open it up to questions from you. And also to let you guys know, I am recording this session and I'm happy to share this with you after we wrap up here. So to get started today, we're going to start with Dr. Jessica Erickson, who is a pediatric infectious diseases physician at the Children's Hospital. Dr. Erickson, so I know the Children's Hospital has seen a bit of an increase in patients with COVID-19 recently. Can you talk a little bit about how is COVID affecting children and what kind of symptoms are you seeing?
You're right. We have seen quite an increase over the past 6 weeks to 2 months or so, really since we got more into the later fall and winter of children who are being admitted to the hospital with COVID-19. We are currently running, probably for the last 2 months or so, we have on average 6 or so patients in the hospital at any given time who have COVID-19. Usually 2 or so of those half dozen will have respiratory symptoms like we're used to seeing from our adult colleagues and their patients. Patients who need oxygen, who occasionally need more substantial respiratory support like BiPAP or even needing to be on a ventilator for some amount of time. But the respiratory symptoms really are the minority of the patients that we're seeing. Most of the patients that we're seeing, at least more than half, have MIS-C or multi-system inflammatory syndrome associated with COVID in children. And those children also have varying severity of symptoms, from having heart failure and needing medicines to make their blood pressure stay high enough to needing anti-inflammatory medications like IV steroids or an antibody-based medication called IVIG. So that's the spectrum of illness that we're seeing, with a small amount of respiratory illness, but most of the children that we're seeing that need to be admitted to the hospital because of COVID have an inflammatory syndrome that can cause inflammation of the heart is the most concerning part of that disease.
Thank you very much, Dr. Erickson. Next, I'm going to introduce Amanda Kells. Amanda is a nurse manager in the pediatric intermediate care unit, and Amanda has been overseeing pediatric COVID care for the last several months at the Children's Hospital. Amanda, can you talk a little bit about what's the day-to-day care like for these patients that are here, and also a little bit about what, the nurses who have been working on the front line, what are they seeing and feeling?
Yeah, so in the beginning, it was definitely, challenging and scary. And I think what made it scary was all of the unknown about COVID-19 and how was it going to impact our pediatric patients. But as we got into the groove of things, it really just became second nature. Our care for these children didn't change significantly. We certainly wear more PPE, that personal protective equipment, to keep us safe and to keep them safe. But they do have dedicated nurses that are looking after just those patients that are infectious. So we make sure that the rest of the children that we're caring for in our unit are kept safe. Despite that PPE, nurses are very accustomed to figuring out how to connect with children despite all of that scary equipment that they're wearing, and really connect with these patients and their families. And I think, despite those challenges and the fear that was associated in the beginning, these nurses have, miraculously faced this with courageous smiles. And, despite being very, fearful in the beginning, you would watch them and they would take this like really big, like deep breath, and they would go into the room, and then they would connect with these patients and families, and they would see, their fear and say, it's okay, I'm here, I've got you, and I'll be brave enough for all of us. And they've really been inspiring to me with how much they've overcome.
Thank you very much, Amanda. Appreciate that. And next I will introduce our last panelist is Dr. Laura Duda. And Dr. Duda is a general pediatrician at the Children's Hospital. Dr. Duda, can you talk a little bit about, so nationally, there's been a reported dip in children keeping up with wellness visits, their annual physicals and things like that, as well as a dip in childhood vaccinations, the typical, MMR and the normally scheduled vaccinations. Can you talk a little bit about why is it so important to maintain that care and keep up with your scheduled vaccinations?
Absolutely. Thank you so much, Barbara. It's great to do this and to try and educate everybody about this. I think as we're also excited about the COVID vaccine and how that has a chance to really change the direction of this pandemic. And it's nice to draw light to the fact that several studies have shown a real dip in vaccination of the other childhood diseases that we can vaccinate for and prevent. In some studies, it showed as much as a 70% drop in vaccination rates during the March and April of this past spring. I think that there was a real issue when coronavirus became a national emergency, and we saw a lot of stay-at-home orders where a lot of parents also had a perceived fear of going to the doctor. So we saw a real drop in people coming for their well child checks. And so the problem is it makes us run the risk of having outbreaks of these other diseases such as measles or varicella during the time when we're trying to do our best with this pandemic of COVID. There's also during the well child checks lots of other screenings and physical exams which can help with health problems that we all need to care for. So the delay in well child care can also cause delays in the care of these other problems. So we're really at Penn State Health, we're really trying to take extensive measures to make people feel safe when they're in the clinic and to try and give a lot of availability so people can come in and get their well child checks caught up and get vaccination rates caught up also.
Thank you very much, Dr. Duda. So we do have a couple of questions who have already coming in here. So again, if anybody has any questions, please use the chat function or the Q&A function. And if you have a question for one of our specific panelists, please indicate that. Otherwise, I think we can kind of determine who might be the best fit for these questions. But we can get started with the first question from ABC 27. And this one, I think we'll start with Dr. Erickson because this is about kids and the vaccine. So I know that there might be some unknowns about this at this point in time, but when the time comes for the public to get vaccine at this point, what are the recommendations for children and the COVID-19 vaccine?
Unfortunately, as is usually the case, children are kind of left behind and we have to play catch up a little bit later. So as of right now, the Pfizer vaccine is approved down to age 16. So older adolescents and teenagers were included in that trial and as part of the approval for that particular manufacturer. The other vaccine manufacturers didn't include even older teenagers in their studies, and none of them included young children. So while we can expect that the vaccines would have similar safety even in younger ages, because children's immune systems often work a little bit differently than adults, we don't know for sure how effective the vaccines would be, or if they should get a different dose, for instance. So until we have more trial information to inform those recommendations, unfortunately, these vaccines won't be recommended for children, with the exception of Pfizer down to age 16. I believe at least 3, if not more, of the companies are beginning trials in pediatrics down to age 1. But those trials, as I said, are just beginning to enroll patients. So we're many months to a year or more even before these vaccines will really be ready for widespread use in children.
That is very helpful. Thank you, Dr. Erickson. We have a question from Laura Duda at WLBR. I'll start, I think Dr. Erickson and Dr. Duda, maybe we'll start with the two of you for this question. Laura is asking, would most of youngsters, pediatric patients with COVID be considered normal, or do they have comorbidities that are typically associated with higher risk for developing COVID? I think meaning patients that wind up needing care in a hospital. Are they typically normal, healthy young kids, or are they kids who might have comorbidities or other health risks?
So I think Dr. Duda can speak to the patients she's seeing in the outpatient setting and the range of symptoms that she's seeing. On the inpatient side in the hospital, the children who need respiratory support, they who have what we talk amongst ourselves as acute COVID. They just got their coronavirus infection recently, and now they're having trouble breathing such that they need extra help in the hospital with that. Those children have nearly all had a comorbidity, obesity, Down syndrome, other significant lung problems. The children who have MIS-C, this post-coronavirus inflammatory syndrome, those have really all been normal children who don't have any comorbidities at all, who don't take any medicines, who have never been admitted to a hospital before. So in contrast to a lot of the coronavirus disease needing to be admitted to the hospital in adults, in children, most of the patients that we're seeing do not have comorbidities.
Dr. Duda, do you have anything to add about that? About what is it, normal healthy kids who you see are getting sick, or kids who typically have other health issues?
We're seeing a lot of kids who are testing positive. Most of them are having very mild disease. Most of them have sometimes just congestion, or maybe just a little vomiting or diarrhea, so extremely mild disease. The few kids that are going on to need hospitalization, the ones who, as Dr. Erickson mentioned, that are needing respiratory support, almost like the adults, they usually have other medical problems, underlying medical problems. But the ones who are getting the multi-system inflammatory syndrome, a lot of those kids are regular kids, and that is happening after they've had COVID.
Thank you very much. And the next question, we have another question from Taylor at ABC 27. And Dr. Duda, I think this is a good question for you. You had mentioned this when we were joining our Zoom here. Talk a little bit about what are the main symptoms you're seeing? I know you said you were kind of surprised that symptoms were very mild. Can you talk a little bit about what are the main symptoms you see from patients with COVID?
Yes, I think originally when we all, way back in February when we were just learning about COVID, I think we were learning that fever is a hallmark symptom. And I think that's true in adults, but in kids, we're actually seeing lots of kids that don't have fever. They just might have congestion, sore throat, a little diarrhea, a little vomiting. So it's really almost a kid with any type of infectious symptoms, we have to suspect that they could be COVID, especially at this time when prevalence in our area is so high. So we really are testing a lot of kids. And when we look back and we see who was positive, a lot of them are having very mild symptoms.
Okay, thank you. And this one I will kind of open up to all of our panelists. I think anybody might have something to add to this one. This is from Victoria at Fox 43. She's wanting to know, what do you tell parents? What safety precautions should parents, keep in mind or implement for very young children, children 5 or for under, as opposed to an adult? Should they be treating COVID differently? What should they be vigilant about? I'm not sure if maybe Dr. Duda, if you want to start.
So a lot of, if they don't have any underlying medical problems, a lot of times the initial illness, it can vary in how severe it is, but most of those kids do overwhelmingly very well. They may be sicker in terms of having a fever or body aches and almost have a flu-like symptom, or they may have a very mild illness for only a day or two. The thing that we worry about the most is sort of this post-infectious multi-system inflammatory syndrome, where you're worried about, and that comes usually a week to several weeks after they were actually diagnosed and had the initial illness. And those kids can get sick very quickly. Usually they have very high fevers, and a lot of them have abdominal pain. And so I think if your child is having very high fevers with abdominal pain, you should reach out to your pediatrician so that you can discuss that.
Thank you very much. Amanda or Dr. Erickson, anything to add, any safety precaution recommendations that you give to parents to make sure they implement with young kids?
Sure. I can share what we're doing here at the hospital. Is that anyone over the age of 2 who is inpatient, we are still asking those children to wear a mask anytime they come in contact with a healthcare worker. And that is recommended by the CDC and American Academy of Pediatrics. I can share from personal experience. I have a young daughter who's 2 and is at daycare, and she is learning to wear a mask and has mastered the skill in 5 days or less. And so it really is achievable. And I think that they find it fun in a way, especially when they get to pick out the theme for their mask. But obviously hand washing is also really important, especially before meals, and that can help reduce the spread as well.
Thank you very much. Dr. Erickson, anything to add to that one? Advice to give to very young kids to implement safety precautions for COVID?
Yeah, I think Amanda really hit on it there. And just to tie what Dr. Duda and Amanda said together, the chance that a child will have a severe illness with COVID is very small. So really the most attention should be paid to keeping them from spreading their illness to other family members, classmates, and people that they come in contact with. So if your child is ill and diagnosed with coronavirus, keeping them in their own room as much as possible, having them take their meals in their own room even, identifying one parent or caregiver who's able to be the primary caretaker for that child, to limit interaction with other household members. Those kinds of things are going to be much more important for the health of the family, because that child is really gonna be just fine.
All right, thank you very much. I see that we have 2 more questions here that we can get to. We have one from Laura, WLBR, and one other question from Taylor, ABC 27. So I will put in kind of a last call for questions here. If anybody else has questions on top of these 2 that we'll ask here, if you could get them in the chat or the Q&A now so we can get to those. So for this question, I think we'll start with Dr. Erickson. This is from Laura at WLBR. She is asking, does MIS-C also present with a blotchy rash, like a high fever? How does that present? And if a parent has an otherwise healthy kid, who might complain of a little sore throat or stomach ache or something, when do you take them to get a COVID test?
So I would encourage parents to be in contact with your pediatrician. There are lots of ways through a conversation on the telephone, through a telehealth visit where The physician can see your child, through a screen, up to an in-person, visit. Your pediatrician is going to be an invaluable resource in helping to decide when your child needs a COVID test, when your child just has strep throat, and when your child really should be seen in the emergency room to make sure that they don't have some of the more dangerous manifestations of MIS-C. The MIS-C, the things that we typically see is very often a rash, usually high fever, very often abdominal pain. Many of these children are worked up for appendicitis and are ultimately found, to not have appendicitis, but that's how significant the abdominal pain can be. Rash is very common. And then the big things that we're looking out for in terms of needing to be admitted to the hospital or seen in the emergency room are low blood pressure, which can happen because the heart muscle itself can be weakened by the inflammation. So those are the kinds of things that you wouldn't know about unless you were seen by a doctor. But the things that parents would see would be fever, rash, abdominal pain, poor appetite, and your pediatrician will be the best one to help you decide when your child needs a COVID test or needs to be seen in the hospital or in the office.
All right, thank you, Dr. Erickson. And our last question here, I think we will start with Dr. Duda for this one. This is from Taylor, ABC 27. So Taylor's asking about, a lot of schools already are back in in-person learning, even 1 or 2 days a week. So that's a lot of young kids and older kids are already back in school every day, but some are also starting to do more returning to school for elementary students. What should parents be on the lookout for, for when and if their children are returning to in-person learning? What kind of advice do you give to parents about making sure their kids stay healthy, and what should they look out for?
I think the most important thing is to reiterate really trying to enforce social distancing and wearing masks in the school. We have seen that kids have done really well in schools, and there hasn't been a huge amount of spread if they are following these guidelines. So I think that Amanda's advice about helping your child get used to wearing a mask, about really talking to them a lot about wearing a mask, social distancing while they're in school, is some of the most important things that we do. And I think each school district is a little bit different and is trying to figure out how to keep schools open and how to educate kids the best they can. And our job should be to try and make it as safe as we can.
Thank you. And bouncing off that, I will just ask Amanda, could you, maybe what's your advice to helping, parents, telling parents how to help a young kid getting used to wear a mask? Like if a kid has to go back to school and now they have to wear a mask all day. What's your advice to help them?
So I think it's, being honest with them about what's going on. I think it's okay to talk about that there is a virus that is out there and can make them very sick. And this is the one thing that we can do to help make sure that they're safe, as well as their friends and their teachers, and really connected to that personal level about why it's important to wear it. We practiced at home, getting Emmy used to it and allowing her to wear it at home to get comfortable and finding the right fit. And I don't know if there's anything else really other than just continuing to engage in that healthy conversation about that, and then allowing them to participate in picking out which one they want to wear in the morning.
That is helpful. And that works for me too. I personally have a big array of, fashionable looking masks that match my outfits, or I have fun picking them out to be.
Yeah, my oldest loves to try and match them with her outfit and coordinate them. So it's a lot of fun.
So just finally, I will ask Dr. Erickson, is there anything that you have to add as far as advice, for parents to make sure that your kids are staying healthy?
I also have a 2-year-old who who can wear a mask. So I think we underestimate the resiliency and adaptability of children. And I've heard a lot of people say, well, they can't possibly wear one all day at school. And the fact of the matter is they can. It's just not a big deal. It really isn't. And I think that we can take that as a lesson from our children as adults, that we can, there are lots of really easy things that we can do to keep our friends and family and neighbors safe. And I'm so thankful that we have this knowledge. You know, back in February, March, we didn't. We were just in fear, and that kept us, you know, at home because we didn't know how to keep ourselves and our loved ones safe. And now we do. You know, we still have a lot of things to work through in terms of getting treatments that work reliably, getting vaccines that work well, available to everyone. You know, there's still a lot of things we need to do. This certainly isn't over yet, but we're so fortunate that we now have a set of tools that we didn't have before, and they're cheap and easy, and you know, even small toddlers can do them, and that's really exciting.
Okay, well, thank you very much, Dr. Erickson. Thank you, Dr. Duda, and thank you, Amanda, for joining us. Thank you to our panelists. Thanks very much. So that will conclude our availability today. Well, there's one more thing coming in. Oh, for our media on the chat here, on the call, my colleague Scott is putting into the chat some things that might supplement coverage to be helpful to you. We have some photos from in the Children's Hospital that you are certainly welcome to use. And we also have, there's a link there to a feature story about children being treated for COVID in the Children's Hospital. So I will also follow up with you to share a recording of this. And again, thank you so much to our panelists for joining us. Everybody have a good day.
Thank you.